Dr. Bill Adams here, and this is an Aesthetic Society Roundtable, and we have a really interesting program for you today. We're going to be talking about patient decision aids, and that's something that not many people have heard about, but they're really the up-and-coming technology to have patients be better informed about surgical procedures. And we've got three great experts to tell us all about this. Dr. Laurie Casas from Chicago, Illinois, Dr. Mindy Haws from Nashville, Tennessee, and Chelsea Hagopian from Los Angeles, California. Let's jump right into this. Laurie, I'm going to start with you, and I'm going to go back to the FDA committee meeting last March because we heard from patients that they weren't getting the information they needed and that they wanted a checklist for informed consent. So how does this fit in?
Well, Bill, thank you very much for having me. And I think it's pretty important to understand that patients need to have a way to understand a procedure, in this case, breast augmentation, that's clear, that's educational, that's easy to read, and they also need a checklist. They told us they need a checklist. So as part of a patient decision aid, a checklist is part of it. So then that way the patient has a way to enter the process, continue the process, and evolve in the process if she chooses to have breast implants, to keep this information in an easy format.
Yeah, and Chelsea, I'm going to jump to you because the patient decision aids are super cool, but I don't think a lot of people even know what they are, and we call them PDAs. So, you know, you basically got a doctorate in nursing practice, and you did a thesis on basically developing patient decision aids. So why don't we just start from the basics, PDA 101, like what is a patient decision aid and how is it going to help us with patients?
Sure. So patient decision aids are evidence-based tools that help patients to meaningfully participate in decision-making about healthcare options. And there really are three defining characteristics of a patient decision aid. One, they make explicit the decisions that need to be made, the options and their features. Number two is that they help patients to clarify and communicate their values and preferences. And number three, they help patients and clinicians work together to make informed decisions based on the clinically appropriate option, the best available scientific evidence, and what matters most to patient. So it really transforms from traditional informed consent documents that are passive, one-way, and focused on clinician disclosure to a two-way active process of it's bi-directional communication where the focus is on education and patient and clinician collaboration.
And you've done some work with the Aesthetic Society and you've developed a patient decision aid for breast augmentation already. But what PDAs are out there now? Are people using these with other surgical procedures currently?
Absolutely. So probably the most use of them currently is in cardiac surgery and orthopedics. They've made a lot of headway with that. I know with cardiac surgery, they have mandated the use of patient decision aids with defibrillator placements. So to get paid for that procedure, you need to be using a patient decision aid. And the key is that patient decision aids really need to meet published standards to ensure their quality. So if we're going to base reimbursement and quality metrics on using a patient decision aid, we need to make sure that they at least meet some minimum standards for safety and quality. And so those are the published standards that are out there.
That's good background. Now, the Aesthetic Society has really, as Laurie said, at the FDA committee meeting, we heard that there was a need for a better way to, it's not just informed consent, but it's really education and informed consent. So what has the Aesthetic Society done to help with this?
You know, it's all about communication, and it's all about helping us better talk with our patients and helping our members better talk with our patients. So once we met Chelsea at the committee hearings and heard, and all of us learned about patient decision aids and that actually other medical specialties are using these successfully, and this is the wave of the future, we realized that this kind of answers our problem in getting good informed consent, but better communication with patients and giving them what they want, making them feel like they're part of the decision. So the Aesthetic Society put together an informed consent task force, which Bill, Laurie, and I are all co-chairs of, And we've added in other plastic surgeons from around the country, both in private practice and academic practice, to work with Chelsea to look at her patient decision aid and see, can this apply to our members? And we're really excited about it. I think that it can, and we're excited to work with her.
Yeah, it's very powerful, and Chelsea, you've done an incredible job putting this together. And I think we're just getting ready to launch this first one on breast augmentation, right, Chelsea? And so, Chelsea, I'm going to go back to you, and then I want to go to Laurie. But how do you, if there's a surgeon out there, and they have somebody sign a disclosure, how would you tell them this is going to help them, and how do you suggest they implement your PDA on breast augmentation?
Sure, that's a great question. So with a patient decision aid, ideally it's used to help prepare patients for decision making. So ideally it would be sent or accessible to a patient before they ever come into the office. And then also it's used throughout the decision-making process across multiple visits. So instead of just at a preoperative appointment where you're signing a traditional informed consent document, this really empowers everyone involved in patient education and decision-making and informed consent processes with quality information that's actually useful when making decisions. So to prepare for decision-making and during decision-making.
And Laurie, I'm going to just I want you to comment on the same question. For a given surgeon, how do you see this helping them?
I think the key for our surgeons in our society is that they understand that this is going to help the entire process. Because if you have a patient that comes in with a deep understanding of the process of the patient, implant selection, even having the procedure, how the procedure is done, the follow-up, the risks, the complications, but in an easy way to digest it and to understand it, and then they have places on the PDA where they can ask questions. When they come in, they're robustly part of that consultation instead of a passive part of the conversation. I think the three of us have always done that anyway, but I think our members need to understand now they have a tool that will enhance that first consultation and most importantly allow a patient to really understand the process.
Yeah, and I remember when the three of us were at the FDA committee meeting, and we met Chelsea, just like both Laurie and Mindy have alluded to, that we've been working for all of us 20 plus years trying to develop that educational process for patients. And it's all about, the more the patients know, the better they do in the surgery. And it's basically this art of informed consent and education, but that's difficult to do. And it's difficult to develop. And so when we saw Chelsea's PDA and learned about it, we're like, oh my God, that's incredible. Like it's like a turnkey way to really do optimal education for your patients. So yeah, we're very excited about it, and I think it's going to be a great tool for surgeons to use, including I think I'm going to implement it in my practice as well, because it'll just enhance what you're doing. Even if you're doing a great job, it's going to enhance what you're doing. If you are struggling to do that, then it's going to be something that you're going to be able to implement right away.
And I think it's important to note that this is not going to expand the time you're spending in your office getting informed consent. This is not a bigger informed consent. This is a better informed consent as a patient decision aid. It's not 15 or 20 pages long. I think it's 5 or 6, right, Chelsea?
Exactly.
But it starts early, and it includes references for the patient so that they can be educated, they can do their homework, and they know who they're going to come and see and why they're there and what the purposes are. But this is not going to make your job harder in the office. It's not a new thing that's going to be so hard to implement. This is going to make all of that easier and more streamlined.
Yeah, that's a great point.
It's designed to support you, your patient, your practice, and the informed consent process should work for you, not against you. So it's to help. So it should help to just streamline everything rather than actually an additive process of an extra informed consent document and not streamlined through the care.
I think the other thing that's super important that I was so drawn to is, besides it being interactive and informative and allowing for the patient to become educated and come to their first consultation ready to do this collaborative approach. I think the biggest thing I like about it is I see it being online. I see it evolving as we get information. So it's not a document that even has to have a date and then be radically changed. It just, information can be added to it. And so it's a great model, Chelsea, and I'm just thrilled that we got to share your ideas with our members, because I think our members are going to be very excited. And
Thank you.
patients, I think, are going to be really informed and educated, which is the key to all of this.
Yeah, I think if it's better for the patient, then it's good for the surgeon and it's good for everybody. And then moving forward, so this is the PDA that we're talking about is breast augmentation. So that will be out. It's actually going to be available very soon in a paper format, and then will also be available on a web-based format, hopefully in the near future. But then, what do you all see in terms of? Do you see us developing these for many other procedures as well?
I do. I mean, when we met Chelsea, we talked about this. We said this is the future, and how can we harness this understanding to help us develop really great patient decision aids for our members and for our patients. And I think one thing we should circle back to is what's really great about this particular patient decision aid that we've developed with Chelsea in terms of our understanding is that there is a checklist, and that's something that the patients really wanted, because they can go through 3, 4, 5 pages of really easy to digest information, but they also want kind of a checklist so they can circle back to things that they're not sure about. So I think that really adds tremendous value.
Yeah, Chelsea, and why don't you comment on that, because that's one thing that we've heard, and the FDA has talked about, that there needs to be a patient checklist, but this PDA is basically, it's a checklist on steroids, basically.
Exactly.
Sure. So the idea of a checklist is essentially to reduce variation in practice that is not specifically based on the patient's individual circumstances and preferences. So ideally, when you're doing the informed consent and decision-making process about a particular procedure, things should be standardized in a way that everyone gets the appropriate information, because you can read online about a lot of things, but you still may not know the true essential information. So by including just what's essential in that patient decision aid, informed consent workbook or module, then it really helps to then catalyze a subjective discussion with their plastic surgeon about what matters most to them, but still making sure that everyone is getting what's most important for a particular surgery. And then, of course, you can always discuss more, but focusing on the essentials first and then building on that.
Mindy, I'm going to give you the final word.
As aesthetic surgeons, we consider ourselves leading in the aesthetic field, that we want to be cutting edge, we want to be scientific, we want to lead the way. This is a way we can also lead the way, patient decision aids. We haven't made these up. These exist in other avenues of medicine. This is the wave of the future. And we really don't want to be left behind using archaic informed consent processes when this is the way of the future. This is our chance to lead out, give our patients the best options available and the best communication tools to help make their decisions.
No doubt. And so just to summarize, remember, patient decision aids, or PDAs, are really efficient ways to educate your patients and really give them better information on surgical procedures. And the one that Chelsea has developed will be available soon to all of us. We're looking forward to that.